All right. Can we start off by asking you a little bit about yourself and your experience with tuberculosis?
Yes, obviously, you can see my website in Duke Global Health Institute. I'm the professor of medicine and global health in medical school, also Global Health Institute, affiliated with DKU and Singapore Health, Duke-NUS, Global Health Institute. So I have a number of hats. I'm also the deputy director of the institute. I see myself as a public health specialist, health services researcher. My first faculty job was at Liverpool School of Tropical Medicine. I joined them January 1998. Before that, I never ever had the opportunity of working or doing research in tuberculosis. But 2 or 3 years later, one of my colleagues from Liverpool University Medical School came to me saying, hey, we need a health policy, health system, health service researcher to work on tuberculosis research. He explained to me why. In terms of diagnosis, in terms of treatment TB, all these technicals looks fine. TB in many developed countries because of health system. So people like you is badly needed to get involved.
Yes.
So in 2000 now is almost 2 decades I have been involved in tuberculosis control research around the world.
Are there other things that aren't related to maybe public health programs that have to do with tuberculosis? We know that tuberculosis has a lot of connections to poverty.
Yes, in African countries, tuberculosis always linked to HIV/AIDS control. And the main reason, there are lots of reasons, but one main reason is, as you know, in African population, probably over 40% of African population were affected by tuberculosis bacteria. And why they didn't get a TB? Because they have a strong or good immune system. But once they got HIV/AIDS infection, then their immune system collapsed. Then most of HIV/AIDS patients got TB as well. So these are comorbidities in Africa. Probably not exactly the same in Asia countries. If you look at China and India, such comorbidity is very lower due to many reasons. And one is, yes, HIV/AIDS has been, paid great attention by politicians in India and China. But the HIV/AIDS infection rates in India and China is very, very low actually. Also, they got lots of funding for HIV/AIDS because of politics, international politics. But in India and China, TB person often got diabetes. And as you know, in these 2 countries, China and India, the most populous country in Asia or in the world, the incidence or prevalence of diabetes is very high. And lots of research looking at the comorbidity of TB and diabetes. Yeah.
How do you how do you prevent TB when you don't have an effective vaccine and TB spreads so easily? What can you do to prevent it?
Ideally, you just treat all the patients. But before treat all the patients, the first thing you should do is case findings. At the moment, there are very low case findings of TB, particularly the multi-drug resistant tuberculosis. So first you need to find the cases, diagnosis all the patients. And second, you report all these cases, and then you put them on the treatment, standardize the treatment. But The challenge is lower case findings in many countries and lower reporting. For example, Indonesia is fourth populous country of 250 million population. Probably 40% of TB cases diagnosed by private health sector never ever reported to the CDC system. So never got a proper treatment. So treatment adherence is poor, and some of the patients are not infectious, others yes. So all these, you could imagine, pose greater challenges in terms of TB prevention.
If you could effect whatever change you wanted, what would you do to improve surveillance and detecting TB cases?
I would say you got to, as I said before, develop a very functional health system in all these countries where TB has endemic. And if different countries have different health system, some country is public health sector dominated, others private health sectors. Regardless of how you organize services delivery, services financing, you need to be effective. So there are no one-fits-all prescriptions in this. At the moment, as you probably have heard in your classes, WHO and other international organizations have pushed this advancement of universal health coverage, ensuring everybody should have adequate access to effective quality health care, have adequate financial protections of health care when seeking health care. So these are the case. Otherwise, I couldn't see there are effective tuberculosis program. Even you put lots of money from donors. There are another issue actually, human resources. This is also part of the health system, as you probably know. When we talk about the health system, there are money issues, financing, there are HR issues, there are technologies, medicine, there are management. HR issue, huge human resources, health workforce for health. It's really a critical issue because, as you probably know, young medical graduates or public health graduates are not willing always, to work in the remote areas, countryside, poor areas, where TB is more serious than those in cities. So if you have money, if you have medicine, but if you don't have doctors, lab technicians, how you could handle?
There are some fireworks going off in the background, so. Okay. One question that we had to do with those rural areas you were talking about. We were wondering, what do you think health programs should do to expand TB coverage and TB prevention into rural areas?
Obviously, as I said, money is not enough. Money is important, funding is important, but not enough. And you need to put doctors and nurses working there, and also you need to put necessary or essential infrastructure there. For example, tuberculosis lab technicians working there. So in addition to that, you need also to educate the public because of some stigmas. People have TB symptoms or people got TB are not willing to seek treatment because stigmas and others. So educate the people through health promotion, health education program to tell people, the public, TB can be cured. And once you take, say, 2 months drug treatment, you are not infectious patient, you're okay. So So we need a concerted action taken place in the countryside, rural areas, in order to have effective TB control in all these developing countries.
Do you think that there needs to be a stronger central system?
If one country where the health system is not functioning well, then short-term solution is strong vertical program. Perhaps. But in terms of long-term sustainable, I still think TB program should be integrated to the general health system service delivery.
So recently, we've read news about things like the Moscow Declaration, where a large number of countries declared their support for combating tuberculosis, and we've seen some statements and meetings from the UN. I was wondering, as someone who's experienced in the field, how do you see the political situation surrounding tuberculosis?
I think, yes, TB control is in high political agenda and at a global level, international level, which is really good. These kinds of meeting is very helpful. It's helpful, but on the end of the day, there are lots of demanding sectors. Education, health, among the health, there are also different burden of disease. So when Minister of Health ask money from Minister of Finance or from President in particular country, and the TB may or may not actually in there one of the priorities. So in many developed countries now, there are two double challenges. One, infectious disease like HIV, TB, malaria. On the other hand, non-communicable chronic disease such as cardiovascular disease, diabetes, cancer have also increased dramatically. So health resources is very limited. Lots of competing interests. So it's not easy for the TB program to persuade the politicians at their own country or donors to invest. Having said that, over the last 10 or 15 years, the international donors, like the Global Fund, like the Bill Gates Foundation, they have put out a huge amount of money to support the TB control in many developed countries. Such a situation may not sustain, as you probably have heard or you have seen, the donors' funding for killer diseases has been stagnated or declined slightly because of poor economic growth in Western countries or because of politics. So, in terms of eradication of tuberculosis in next 2 or 3 decades, I'm not really optimistic about it.
Then our final question would be about this pessimism that you have about whether we will be able to eradicate tuberculosis in the coming future. What would you think we need to do if we want to achieve that goal?
We need to develop more effective medicines, drugs to shorten the TB treatment. There are a number of the drugs in the pipelines, in the clinical trial, which could be used to treat a TB patient for, say, 3 or 4 months, but still not a couple of months, right? We want a magic medicine that can be used to treat a TB patient for a few weeks instead of a few months. So that's one thing I hope to see. Second, always vaccine development. If we have really high quality vaccine for TB, then things will change dramatically. In the meantime, while we're waiting for new technology advancement, we should invest more to support TB control, but particularly in this poor country.
Thank you.
Thank you.
Well, have a good day.
Good night.
Goodbye.
You too. Bye.
Bye-bye.